Leveraging clinical nurse specialists for organizational success is our episode topic. My guest is Rick Bassett, adult critical care clinical nurse specialist at the Nursing and Patient Care Center of Excellence within St. Luke's Health System, and current president of the National Association of Clinical Nurse Specialists. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Rick, thank you so much for joining us today.
You bet. I'm glad to be here. Thank you.
And happy Clinical Nurse Specialist Week to you.
Oh, thank you so much. Yeah, this is a great time to celebrate all the accomplishments that CNSs have done through the year and do all that we can at NACNS to provide toolkits and to make sure that our clinical nurse specialists across the nation and, in fact, throughout the world have some things that they can do to celebrate clinical nurse specialists at their own facilities and workplaces.
Awesome. And we're going to talk a little bit more about that in a few minutes. But before we get into our episode topic, can you share a little bit about yourself with our listeners?
This is a great opportunity for me to share information about the exciting and valuable role of the clinical nurse specialist. And if you talk to any of my coworkers, in fact, people in my personal life, they will say that that's who I am. This is a big part of me. I live in Boise, Idaho, and work at the largest healthcare system in Idaho, St. Luke's Health System, as a adult clinical nurse specialist. And I've been a nurse for 37 years, all of those years at St. Luke's, and 16 of those years I've been a CNS. I have a passion for superior patient outcomes and in improving patient experience. I'm involved in local, regional, and national legislative efforts and have been so since I've been a CNS. And I do that because I want to improve access to healthcare. I want to advocate for nurses, for patients and families. I want to advocate for support efforts to allow advanced practice nurses to have full practice authority and prescriptive authority.
We've had a few episodes so far on this podcast channel talking about clinical nurse specialists, also known as a CNS, and the great work that they do. Just some examples. In season 2, episode 20, one of your predecessors, Mitzi Saunders, talked about maximizing CNS values. And then in season 3, episode 19, we had Lauren Brewer, where she talked about her work at the Cleveland Clinic and addressing the needs of unique patient populations. Just for some level setting and a quick refresher, can you remind us what exactly is a clinical nurse specialist and how do they differ from health system to health system?
A clinical nurse specialist, or CNS, is an advanced practice registered nurse, and that's APRN. So if you hear those two acronyms, that's what they stand for. And they are prepared by a master's or a doctorate or a postgraduate certificate level in a CNS program. There's several of those across the nation. CNSs provide diagnosis, treatment, and ongoing management of patients, specialty populations, and those with chronic illness across the continuum of care. The CNS also provides expertise and support to the interdisciplinary team caring for patients to help improve outcomes. So it's not just about the nurse. It's not just about, you'll hear CNSs that they support nursing practice, and we certainly do, but we're there for everybody. So for me, for adult critical care, I support every single person that is there at the bedside that is giving care to that patient, giving care to that family. They lead evidence-based practice. They optimize organizational systems and advanced practice nursing. So there's a lot of things that a CNS is doing on any given day. And as far as how they differ from system to system, I'm glad that you asked that because that's really an important thing to talk about because the CNS is the most, in my opinion, versatile APRN role. You can find CNSs practicing at the bedside as consultants and providers. They can be working at the unit or service line level to lead innovative improvements in patient care and or working at the system level to lead practice, patient care workflows, and quality improvement activities that impact patient outcomes and experience, workforce satisfaction, and financial efficiency. So, while the patient is at the center of all we do, and it's at the center of everything I do each day, we are involved in leading efforts to improve workforce experience. We want to make sure that people stay in our organization, that they have the support they need to be healthy practitioners.
Now, what are some of the CNS driven projects that you've seen recently that are driving innovation in healthcare?
I've seen CNSs collaborating with executives, quality and safety specialists to reduce preventable harm in healthcare facilities. There's lots of examples of that if you look in the publications and you talk to CNSs across the nation. One example is our work with teams to reduce medication errors by providing better clarity in medication orders, working with vendors to medicate look-alike, sound-alike medications, and also to work with pharmacy and providers to evaluate evidence-based workflows that create efficiency and reduce irrational variation across healthcare systems that lead to better medication practices. Another example is our work to identify key components to facilitate the timely removal of invasive lines. For example, urinary catheters, central venous lines, and endotracheal tubes. CNSs are well positioned in their role to understand both the clinical and logistical issues that contribute to infections related to these lines and devices. Their work to lead teams and collaborate with others throughout the healthcare system has led to effective and innovative protocols and workflows resulting in less infections, reduced time on the ventilator, shorter ICU and hospital length of stay, and who wouldn't want to get out of the hospital sooner, right? And also a higher likelihood of being discharged to home. And that's an important thing. Sometimes we think, well, the patient made it out of the hospital alive, but we want them going home, not to a secondary facility. Lastly, I want to mention the impact of the CNS at the legislative level. There are many opportunities to drive innovation and create better and safer healthcare. I've been involved in legislative activity since I became a CNS, and I've helped to draft legislation, advocate for bills, and provide testimony to legislative committees, all in an effort to improve the experience for our patients and their families. We need more CNSs working and advocating at the legislative level because they understand healthcare systems. They understand how clinical care is provided, and they understand what needs to be done to create safer and more efficient healthcare.
So, how can CNSs take on leadership roles within a system while sticking to their clinical patient focused roots? What's that look like?
Well, there's lots of opportunities there. As previously touched on, I've given some examples of this already. In a more formal sense, however, we see CNSs in traditional leadership roles like Chief Nursing Officer or VP for Patient Care, managers, directors, or VP for Quality. And we see them in other formal leadership roles, leading research, innovation, workforce management, and many other formal leadership roles. In each and every one of these roles, their clinical and patient-focused roots are essential to being successful in that role. This is because the patient is at the center of all we do. And I say that again and again because it's important to note that they are at the center of everything we do in healthcare, regardless of our role. That is what makes the CNS a perfect leader in many different aspects.
So, what advice would you give to new nurses who are considering a CNS career path to experienced CNSs who are taking on mentees?
Well, that's a great question, Nick. And I think there are so many great opportunities for nurses out there. For me, as I learned more about the CNS role when I was a newer nurse, I realized that my niche in nursing was to become a CNS. For those considering the CNS career path, I think being a CNS provides them with a multitude of future opportunities. We talked about some of the leadership opportunities that a CNS can have, but there's a host more opportunities that they can take advantage of. As we've discussed, there are various roles in this that the CNS may serve in, from direct care, service line, and system level to formal leadership roles. I think that that's an attractive thing to be able to do any of those things. I also feel that the CNS role is the most versatile of the APRN roles, which is also a very attractive aspect to becoming a CNS. It's important that each nurse who is considering the CNS career path, that they have specific goals in mind, as that will help to guide them on their journey to search for specific specialties and aspects of the CNS role.
What advice would you give to nurse executives who are trying to figure out how to expand the role of CNSs in their organization?
Well, first of all, I think it's important that all nurse executives fully understand the value and the role that a CNS can play within their organization. That role can look a lot different in a critical access hospital that only has 25 beds to a very large university hospital that has 800 beds. But regardless of the size of the organization, the CNS will bring value to that patient. They will bring value to those families. They will, as I mentioned before, they will reduce hospital length of stay. They will reduce infections. They will basically do things that provide a better patient experience while saving money for the organization and creating more efficient healthcare. So I think that's where to start as a leader. And then don't let yourself be limited as a leader when you're considering how to utilize the CNS role. The CNS can provide value, like I said, in just creating workflows and protocols and policies and procedures, and making sure that our bedside staff have all the tools and the knowledge and the resources they need to be successful. But they can also be direct care providers. In many cases, CNSs have prescriptive authority. And so there's ways that CNSs can provide consults and be able to be revenue generating, not just cost saving for the organization.
As you mentioned at the beginning, your career experience has been limited to really one healthcare system. But in your talkings with other CNSs and your exposure with NACNS from across the country, you're talking about the variety. I'm assuming you're hearing about the variety. Is the role of the CNS generally misunderstood by nursing leaders? Is there a gap that exists there that we need to work on trying to improve? Tell me your thoughts on that.
Absolutely. And I've thought about that in different aspects. What are we working on at NACNS? But I'll just say that absolutely, to be fully transparent, for those nursing leaders that have worked with CNSs, there is no doubt in their mind the value that the CNS brings the team and the organization. But for those nurse leaders that have never worked with a CNS, never been exposed to that value, there is a huge opportunity there.
And so for experienced CNSs who are taking on mentees, what advice would you give them?
I would ask them to reflect on their mentors, the people that have given them their time and their expertise at a point in each of our careers. And it doesn't just have to be healthcare, but it could be in anybody's career. You get to the point where you can pay it forward, where you can give back. And I think that experienced CNSs, that's where they are in their career, is that they have time now to give back some of their expertise to help future or evolving CNSs to avoid some of the pitfalls, to be able to leverage the success that all CNSs can have. And so I would say to be generous with sharing your experiences, whether it's a formal mentorship or an informal conversation. I call those curbside consults with other people. But just when you have somebody that wants to just chat with you, share your time, share your experiences. Organize your conversations with your mentee in a way that it has direct application to their work. It's not hard. A mentor-mentee relationship is not just an onboarding relationship. It's just not for the experienced and the new CNS. It's a lifelong professional relationship, and I've treasured the relationships I've had with those I've mentored through the years.
So, how do you see the NACNS evolving over the next couple of years to better support clinical nurse specialists? And what is that organization's long-term goals?
There are so many ways to answer that question, but I want to start by saying that NACNS is very focused on advocating that every CNS have full practice and prescriptive authority. That's essential. This varies across the nation, and this work is fundamental to our ability to positively impact the future of healthcare. NACNS is also actively working to increase the awareness and value and knowledge of the CNS role, as I've mentioned earlier. This particular effort has several strategies from marketing to elevator speeches and to more visibility at various healthcare conferences representing other organizations in healthcare. As healthcare leaders and others learn more about how the CNS can impact and lead healthcare outcomes, they, like others who have and do work with CNSs, will create a demand for more CNSs. We are working with our members to create opportunities for future professional engagement and advancement. And we also collaborate with CNSs and CNS groups across the world. We don't do this just within the United States. We support the advancement of the CNS role outside of our country as well. And just as a note, NACNS is the largest organization that exclusively represents CNSs.
Any closing thoughts as we wrap up this episode?
Well, I just want to talk a little bit about NACNS's long-term goals. Our long-term goals are designed to support our vision. And our vision is that every CNS or APRN with full scope of practice is able to become a transformational leader, leading improvement in healthcare environments, resulting in superior healthcare outcomes from populations they serve. So I'm not just talking hospitals. I'm talking everywhere, ambulatory, community. We have CNSs that serve in all different aspects of healthcare. It is no coincidence that I have mentioned these goals. We invite all CNSs to be members of NACNS. Together, we are stronger and more able to advocate for the role and better patient care. Lastly, we want the knowledge and the understanding of the CNS role to expand to all of healthcare, policy and legislative representatives throughout our communities, and to be something that our patients and families are aware of so that when they interact with the CNS, they know how that CNS is impacting their healthcare.
Leveraging clinical nurse specialists for organizational success has been our episode topic. To all of the CNSs that are listening, I wish you a very happy Clinical Nurse Specialist Week. Rick Bassett, President of NACNS, thank you so much for your time today.
Thank you very much, Nick. Appreciate it.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.